Hi guys, welcome back. This is Hillary, the bipolar beacon, attorney, wife, and mother, living in Arkansas, living with bipolar disorder and triumphing in spite of it all. And I know what you're going through. I've been there, and you can triumph too. And I'm going to give you some tools and tips on how to do that. And I've written a book about it, Through the Open Door. That's on Amazon and linked below. But on page 104 of the book, I have mental health tips for you and your family and your providers about how to manage your illness. And one thing I do is that it used to be, it's been 15 years since I was diagnosed, and it used to be that with the slightest mood change or racing thought or depression, I would call my doctor and we'd change something. We'd change a medication. I've realized over the years that it's best to sit it out just a little bit, maybe 12 to 24 hours, and see what really is going on. Because mania takes different shapes and forms all the time. One mania is never the same as the next. And so with my 5 medications that I take, sometimes we don't know if we're supposed to increase the Risperdal or lower the trazodone. And if we do a knee-jerk reaction, as soon as something starts to feel funny, then my doctor and I don't really know what's going on and what type of episode it is. So if you can, this might not be the best advice. I'm not a doctor, okay? I'm not a doctor. But for me at least, it helps me to sometimes, if I can afford to, wait a day to see what's really going on. There may be other things outside my life that are going on that are affecting my mood or my emotions or my mental chemistry. So that's one thing that I recommend for me. At least that works for me. And obviously, if you're in a crisis and you're suicidal, don't wait a second. Don't wait one single second. Get to the ER. Call 911. Call the suicide hotline. I'm telling you that now. Don't wait it out if you're in a real crisis. But you can tell the difference between a mild change and a real crisis. But the other thing I do that helps, another tool, is to say, okay, what is different in my life this week to last that has caused me to start flying one way or the other with bipolar? And I look at all areas of my life and I say, okay, have I lost my job? Have I gone bankrupt? Has one of my kids broken his leg? Have my parents got divorced? Has somebody I love died? Have I had a car wreck? I mean, any of those big things would cause a mood swing and would cause something to be off balance. But if nothing has changed in the last week, then we know it's chemical. Then we know it's the neurons, the neurology, the circuitry. There's something dripping too fast or too slow in your brain, and it needs medication. It needs a medical solution. So I would do that. I would say that question to yourself. What's changed in the last week? And that helps clarify it for me. So that's just another tool for you to use. Remember, call a doctor if you're having a crisis. Call 911. But some of these tools I've learned over the years have helped me. So I continue to bring light and joy and usher in a new era of understanding mental illness, of understanding who we are as humans, of understanding the next epic. Heaven on earth is coming. I've been there. I've got great news to share with you about it. So continue the journey with me. And I enjoy being with you. Y'all are gods and goddesses. I love you all. You're perfect. You're all the prophet. Any one of you out there, any one of you can save the world. I believe in you. Thank you.